Question 1. A 68-year-old male is admitted with acute exacerbation of chronic obstructive pulmonary disease, COPD, due to streptococcal pneumonia. The patient also has a history of type 2 diabetes mellitus controlled by oral medication. How would you sequence the diagnosis codes for this encounter? A. J44.1, J15.4, E11.9. B. J15.4, J44.1, E11.9. C. J44.0, J15.4, E11.9. D. J44.1, J15.4. Answer: A. J44.1, J15.4, E11.9. This question tests your understanding of ICD-10-CM coding for multiple conditions, especially when one condition is an exacerbation of another. The keyword due to indicates a causal relationship between the pneumonia and the COPD exacerbation. According to ICD-10-CM guidelines, when an acute condition like pneumonia causes an exacerbation of a chronic condition like COPD, you typically code the chronic condition with exacerbation first, followed by the acute infection. The diabetes is a coexisting condition and is coded last. Remember, due to often signals a specific coding relationship you need to follow based on the guidelines. Question 2. A patient presents to the office for evaluation of a new nevus, mole, on their back which has changed in size and color. The physician performs a detailed history and detailed examination, and makes a medical decision of moderate complexity. The physician decides to excise the lesion during the same visit. How would you code the E/M service? A. 99,214 to 25. B. 99,204. C. 99,214. D. 99,213 to 25. Answer: A. 99,214 to 25. This scenario requires coding both an evaluation and management, E/M, service and a procedure performed during the same visit. The E/M service involved a detailed history, detailed exam, and moderate medical decision-making, which typically supports a 99,214 level of service for an established patient. Since a separate procedure, excision of the nevus, was performed in addition to the E/M service, a modifier is needed to indicate that the E/M was significant and separately identifiable from the procedure. Modifier 25 is appended to the E/M code for this purpose. When a procedure is done on the same day as an E/M, ask yourself if the E/M work was significantly above and beyond the typical pre- and post-procedure work included in the procedural code. Question 3. A physician performs a complex repair of a 3.5 cm laceration on the patient's scalp. The wound required extensive undermining and involved deeper layers of subcutaneous tissue. What CPT codes would you report? A. 12,032. B. 13,121. C. 13,132. D. 13121, 13120. Answer: B. 13121. This question tests your knowledge of CPT coding for wound repairs, specifically complex repairs based on size and location. The keyword complex repair directs you to the complex repair section of CPT. The location is the scalp, and the size is 3.5 cm. CPT code 13121 is for complex repair of the scalp, arms, and/or legs, 2.6 cm to 7.5 cm. Remember to always consider the type of repair: simple, intermediate, complex, the location, and the size of the wound when selecting a repair code. Question 4. A patient undergoes a bilateral screening mammography. What HCPCS Level 2 code is reported for the technical component? A. 77067TC. B. G0202. C. 77065TC, 77066TC. D. G0204. Answer, B, G0202. This question asks for the correct HCPCS Level 2 code for a specific type of radiology service. The keywords bilateral, screening, and mammography are crucial. G0202 is the specific HCPCS code designated for screening mammography, bilateral. Many radiology services have dedicated HCPCS codes, especially for common screenings, so it's important to check the HCPCS code set in addition to CPT when coding for Medicare or other payers requiring HCPCS. Always verify if a specific G code exists before using a CPT code. Question 5. Which of the following is the correct anatomical term for the collarbone? A. Scapula. B. Clavicle. C. Sternum. D. Humerus. Answer, B. Clavicle. This is a basic anatomy question relevant to medical coding, as anatomical terms are used throughout code descriptions. The question asks for the term for the collarbone. The clavicle is the anatomical name for the bone commonly known as the collarbone. Knowing basic anatomy is essential for accurately identifying body parts and structures described in medical documentation and code descriptions. Familiarize yourself with common anatomical terms for major bones and organs. Question 6. A patient is seen for follow-up of hypertension and stable angina. The physician reviews systems, performs a limited physical exam, reviews recent lab results, and adjusts one medication. The encounter takes 15 minutes. Based on the documentation, which E/M code is most appropriate using time as the key component? A. 99,212. B. 99,213. C. 99,214. D. 99,215. Answer, B. 99213. This question tests your ability to select an established patient E/M code based on time when counseling and/or coordination of care dominates the encounter. The documentation describes a follow-up visit for chronic conditions where the physician reviewed data, adjusted medication, and the total time was 15 minutes. For established patient office visits, 99,212 to 99,215, the typical time ranges are provided in the CPT code descriptions. A 15-minute encounter aligns with the typical time for CPT code 99213, typically 15 minutes, range 10 to 19 minutes for 2021 plus E/M guidelines or typical time for prior guidelines. When using time to select an E/M level, ensure the documentation clearly states the total time spent and that more than 50% of the face-to-face or total time was spent on counseling/care coordination for older guidelines, or that time is chosen as the basis for code selection for 2021 plus guidelines. Question 7. A patient has a biopsy performed from the stomach via endoscopy. The pathology report later identifies Helicobacter pylori. How should the pathology service for the H. pylori identification be coded? A. 88,305. B. 88,307. C. 88305, 87081. D. 88305, 87338. Answer, D. 88305, 87338. This scenario involves coding both the surgical pathology service and a specific test performed on the biopsy specimen. The biopsy itself falls under surgical pathology coding 88300 series. A biopsy from the stomach is typically coded as 88305. The identification of Helicobacter pylori using a rapid urease test or enzyme immunoassay requires a separate microbiology or chemistry code. Code 87338 specifically represents the Helicobacter pylori enzyme immunoassay, EIA, stool, antigen. Remember that pathology coding often involves coding the examination of the tissue and any specific tests performed on that tissue. Question 8. A patient presents with chest pain. The physician orders an electrocardiogram, ECG, and personally interprets the results. The physician's note includes the findings, a diagnosis based on the ECG and clinical presentation, and the treatment plan. Which CPT code accurately reflects the physician's service for the ECG? A. 93,000. B. 93,005. C. 93,010. D. 93,010-26. Answer: C. 93010. This question asks about coding for an ECG when the physician performs both the technical and professional components. CPT code 93,000 includes both the tracing, technical component, and the interpretation and report, professional component. CPT code 93005 is for the tracing only, technical component. CPT code 93010 is for the interpretation and report only, professional component. Since the physician personally interprets and documents the results, they performed the professional component. Code 93010 is used when only the interpretation and report are being billed by the physician. Code 93,000 would be used if the physician owned the equipment and performed/supervised the tracing and interpreted it. In many hospital or clinic settings, the facility bills the technical component and the physician bills the professional component. Question 9. A coder needs to assign a code for sepsis due to methicillin-resistant Staphylococcus aureus, MRSA. Which is the correct ICD-10-CM code assignment? A. A41.02. B. A41.9, B95.62. C. A41.02, B95.62. D. A41.9. Answer: A. A41.02. This question tests your ability to code sepsis with a specific organism. The condition is sepsis, and the causative organism is MRSA. In ICD-10-CM, there are specific codes for sepsis due to certain organisms. A 41.02 is the code for sepsis due to methicillin-resistant Staphylococcus aureus. Always look for combination codes in the ICD-10-CM index and tabular list when a diagnosis includes both a condition and its causative organism. Avoid coding the organism separately if a combination code exists. Question 10. A surgeon performs an appendectomy, removal of the appendix, using a laparoscopic approach. What is the correct CPT code? A. 44,950. B. 44,970. C. 44,960. D. 44,900. Answer: B. For 4970. This question requires selecting the correct surgical code based on the procedure performed and the surgical approach. The procedure is an appendectomy, and the approach is laparoscopic. CPT code 44970 describes the laparoscopic appendectomy. CPT code 44950 is for an open appendectomy. The surgical approach, open, laparoscopic, endoscopic, etc., significantly impacts code selection in CPT. Pay close attention to how the procedure was performed as documented in the operative report. Question 11. A physician performs a Level 3 office visit for an established patient. The documentation indicates a straightforward medical decision complexity. What is the correct CPT code? A. 99,213. B. 99,214. C. 99,212. D. 99,203. Answer: A. 99213. This question tests your understanding of selecting an E/M code based on medical decision making, MDM, which is a key component. For established patient office visits, 99,211 to 99,215, MDM is one of the main factors in determining the code level for 2021 and later guidelines. A straightforward MDM complexity corresponds to a 99,213 level of service. Remember the 4 levels of MDM: straightforward, low, moderate, and high, and how they generally correlate with E/M code levels. Question 12. A patient is diagnosed with malignant neoplasm of the lower lobe, left lung. What is the correct ICD-10-CM code? A. C34.11. B. C34.12. C. C34.31. D. C34.32. Answer: B. C34.12. This question requires specific site and laterality coding for a malignant neoplasm in ICD-10-CM. The location is the lower lobe of the lung, and the side is the left. ICD-10-CM code C34.12 is for malignant neoplasm of lower lobe, left bronchus, or lung. Laterality is important for many codes in ICD-10-CM, including neoplasms, so always look for documentation specifying left, right, or bilateral. Question 13. A pathologist examines a breast biopsy submitted in 2 separate tissue blocks. What is the correct surgical pathology CPT code? A. 88,304. B. 88,305. C. 88,307. D. 88,309. Answer: B. 88305. This question tests your knowledge of surgical pathology coding based on the complexity of the specimen and the type of procedure. A breast biopsy is typically classified under the level corresponding to 88,305, which includes specimens like biopsies of specified organs, including breast. The number of blocks often influences the pathologist's work, but the primary code selection is based on the type of specimen and the level of examination required. Code 88305 is appropriate for a breast biopsy. Question 14. A physician performs a complete removal of a foreign body from the external auditory canal, ear canal, without requiring incision. What CPT code is appropriate? A. 69,200. B. 69,205. C. 69,210. D. 69,220. Answer: C. 69210. This question asks for the correct CPT code for removing a foreign body from the ear canal based on the method used. The keyword "without requiring incision" is key. CPT code 69210 is for removal of impacted cerumen, earwax, or foreign body from external auditory canal, requiring instrumentation, without microscopic guidance. Code 69200 is for removal requiring incision. Code 69205 specifies requiring general anesthesia. Pay close attention to how the foreign body was removed and whether incision or anesthesia was necessary. Question 15. A patient presents with acute pain in the left knee. The physician performs an aspiration of the knee joint. What CPT code is reported for the aspiration? A. 20,600. B. 20,610. C. 20610 RT. D. 20,611. Answer: B. 20610. This question asks for the CPT code for a joint aspiration. The procedure is an aspiration of a major joint, knee. CPT code 20610 is for arthrocentesis, joint aspiration or injection, of major joint or bursa, example shoulder, hip, knee, subacromial bursa, with or without anesthetic. While laterality is important in ICD-10-CM, it is reported with modifiers, like RT for right, LT for left, in CPT if the code description does not specify laterality or if required by the payer. The base code for a knee aspiration is 20,610. Check payer requirements regarding laterality modifiers for specific procedures. Question 16. A coder needs to assign a code for acute cystitis due to E. coli. Which is the correct ICD-10-CM code assignment? A. N30.00. B. N30.00, B96.4. C. N30.01, B96.4. D. N30.01. Answer: B. N30.00, B96.4. This question tests coding for a condition caused by a specific organism when there is no combination code available. The condition is acute cystitis, N30.00, and the causative organism is E. coli, B96.4. There is no single combination code for acute cystitis due to E. coli. Therefore, you code both the condition, acute cystitis, and the organism, E. coli. When coding infectious diseases, first look for a combination code, and if none exists, code the condition and the organism separately. Question 17. What does the abbreviation SOAP stand for in medical documentation? A. Subjective, Objective, Assessment, Plan. B. Symptoms, Observation, Analysis, Procedure. C. Syndrome, Organ, Anatomy, Physiology. D. Status, Outcome, Actions, Progress. Answer: A. Subjective, Objective, Assessment, Plan. This is a medical terminology and documentation structure question. SOAP is a widely used acronym for organizing patient encounter notes. It represents the standard format for documenting a patient's visit. Subjective information is what the patient reports, objective information is what the clinician observes or measures, assessment is the diagnosis or conclusion, and plan is the course of action. Understanding SOAP is vital for coders as it helps locate relevant information in the medical record to support code selection. Question 18. A physician performs a removal of skin tags, 15 total, from various locations on the patient's trunk. How would you code this procedure? A. 11,200. B. 11,201x14. C. 11200, 11,201x14. D. 11,200 with units of 15. Answer: C. 11200, 11201x14. This question tests coding for multiple removals of benign lesions like skin tags. CPT code 11200 is for removal of skin tags, multiple fibrocutaneous tags, any area, up to and including 15 lesions. CPT code 11201 is an add-on code used in addition to 11,200 for each additional 10 lesions or fraction thereof. Since 15 tags were removed, you report 11200 for the first 15 lesions. If more than 15 were removed, you would use 11201. In this case, 15 lesions are covered by the primary code 11200. Correction: the question asks for 15 total. 11200 covers up to and including 15 lesions. There is no need for 11201. Let's reevaluate the codes and question. 11200 is up to and including 15. So, for exactly 15, only 11,200 is needed. Let's reevaluate the question and options carefully. The question states 15 total. CPT 11200 covers up to and including 15. So, 11,200 covers all 15. Option C suggests using 11201x14, which is incorrect based on the code description. Option A is the correct code for up to and including 15. Option B and D are incorrect uses of the code and units. Correct answer: A. 11200. This question tests coding for multiple removals of benign lesions like skin tags. CPT code 11200 is for removal of skin tags, multiple fibrocutaneous tags, any area, up to and including 15 lesions. Since exactly 15 skin tags were removed, CPT code 11200 is the single appropriate code. CPT code 11201 is an add-on code used only when more than 15 lesions are removed. Always read the up to and including language carefully in CPT codes. Question 19. What is the primary purpose of the Healthcare Common Procedure Coding System, HCPCS, Level 2 codes? A. To report inpatient hospital procedures. B. To report physician services. C. To report medical supplies, equipment, and services not included in CPT. D. To report diagnoses. Answer: C. To report medical supplies, equipment, and services not included in CPT. This question asks about the purpose of HCPCS Level 2 codes. HCPCS Level 2 codes are alphanumeric codes primarily used to report products, supplies, and services not covered by CPT codes, such as ambulance services, durable medical equipment, prosthetics, orthotics, and some drugs. While some physician-administered drugs are included, their main role is to capture items and services beyond standard physician procedures. CPT is for physician procedures and services, ICD-10-CM is for diagnoses, and inpatient procedures have their own coding system, ICD-10-PCS. Question 20. A patient is seen in the emergency department for a fractured left ankle sustained earlier that day in a fall. The physician performs a detailed history, detailed examination, and medical decision-making of moderate complexity. The physician also performs closed reduction of the fracture without manipulation. How would you code this encounter? A. 99283, 27760 LT. B. 99284, 27762 LT. C. 99284 to 25, 27760 LT. D. 99284 to 25, 27762 LT. Answer: D. 99284 to 25, 27762 LT. This scenario requires coding both an emergency department, ED, E/M service and a procedure performed during the visit. The ED E/M involved a detailed history, detailed exam, and moderate MDM, which supports a 99284 level for the ED. The procedure is a closed reduction of a fractured ankle without manipulation, which corresponds to CPT code 27762, closed reduction of medial malleolus fracture, without manipulation. Since the ED visit was significant and separately identifiable from the fracture care, which has its own global period, modifier 25 is appended to the E/M code. Laterality, LT for left, is appended to the procedure code. Remember to use modifier 25 on the E/M when a significant, separately identifiable E/M service is provided on the same day as a procedure with a global period. Question 21. A patient presents with a boil on their arm. The physician incises and drains the abscess. What is the correct CPT code for this procedure? A. 10,040. B. 10,060. C. 10,080. D. 10,120. Answer: B. 10060. This question asks for the CPT code for incising and draining a simple abscess or boil. The procedure is incision and drainage, IND, of a boil, furuncle, or carbuncle. CPT code 10060 is specifically for incision and drainage of a cutaneous abscess, carbuncle, furuncle, boil, or cystic structure, simple. Pay attention to the type of lesion, abscess, cyst, hematoma, etc., and whether the IND is described as simple or complicated / multiple, as this affects code selection within this code range. Question 22. In the ICD-10-CM index, the entry abscess, appendix directs you to code K35.3-. This indicates that A. K35.3 is the complete and final code. B. K35.3 requires an additional characters for specificity. C. K35.3 is a primary diagnosis only. D. K35.3 requires a code from the B chapter. Answer: B. K35.3 requires an additional characters for specificity. This question tests your understanding of instructional notations in the ICD-10-CM index and tabular list. The hyphen symbol after a code in the index or tabular list indicates that additional characters are required to complete the code. These additional characters provide greater specificity, such as laterality, episode of care, or other clinical details. Always follow the hyphen instruction and consult the tabular list to find the necessary additional characters. Question 23. A patient is brought to the operating room for an open reduction and internal fixation of a comminuted fracture of the distal radius, wrist bone, on the right side. What is the correct CPT code? A. 25574. B. 25607. C. 25608 RT. D. 25609 RT. Answer: D. 25609 RT. This question requires selecting the correct CPT code for fracture treatment based on location, type of fracture, and method of treatment. The location is the distal radius, wrist, the fracture is comminuted, multiple fragments, and the treatment is open reduction with internal fixation, ORIF. CPT code 25609 is for open treatment of distal radial fracture, example Coles or Smith type, or epiphyseal fracture, with or without intra-articular extension, with internal fixation. The RT modifier indicates the right side. Pay close attention to whether the fracture treatment was open or closed, with or without manipulation, and whether internal or external fixation was used. Question 24. Which of the following is considered a key component when selecting an E/M code for a new patient office visit, 99202 to 99205? A. Time. B. Counseling. C. Coordination of care. D. Medical decision-making. Answer: D. Medical decision-making. This question asks about the key components used to determine the level of a new patient office visit, for 2021 and later guidelines. For new and established patient office visits, 99202 to 99205, 99212 to 99215, under the updated E/M guidelines, medical decision-making, MDM, or total time are the key factors used to select the code level. While history and examination are still required and documented, they no longer determine the level. Remember that for 2021 and later, MDM or time are the two paths to selecting the E/M level for office visits. Question 25. What does the medical term cholecystectomy mean? A. Surgical removal of the appendix. B. Surgical removal of the gallbladder. C. Surgical removal of the kidney. D. Surgical removal of the spleen. Answer: B. Surgical removal of the gallbladder. This is a medical terminology question focusing on surgical procedures. The term cholecystectomy breaks down into cholecyst - meaning gallbladder and ectomy meaning surgical removal. Therefore, cholecystectomy means surgical removal of the gallbladder. Understanding common medical prefixes, roots, and suffixes is invaluable for deciphering unfamiliar medical terms encountered in documentation.